some answers for why she's deteriorated, at least in the last 2 days, because we've been doing blood work every 2 to 3 days,
Yeah.
and her kidneys, like, just got blood work back right now. Her kidneys show that, like I explained to your sister, she asked about IV fluids. She is dry. So I've already started, we're gonna start IV fluids. I've ordered it. So I'm gonna give her more aggressive IV fluids because on Monday her kidney function was completely normal. Today, it shows that she is dry, probably because she's not eating and drinking.
Yeah.
Yeah. So that's something I can fix. But
Okay.
that doesn't explain why she's deteriorated in the last, like, week and a half, 2 weeks. Because on Monday, that could explain the deterioration maybe in the last 2 days. But on Monday, her kidney function was completely normal. So today, I agree she's dry. So we are going to give her fluids. The other thing is, remember, she finished antibiotics on Sunday. On Monday, I re-imaged her. Like, that's when I told her there was no recurrence of the infection. Today, though, and I've recultured her blood every day for the last 2 days. That hasn't gone back into her blood. But on the blood work that I just got back, she's brewing an infection again. Her white count, which is a measure of infection, is going up again. It hasn't gone into her blood. At least it hasn't shown that it's growing in her blood yet. But remember 2 weeks ago when we had the discussion about the infection? The source, we're assuming, is from the gut. Remember, she's not a candidate for putting in a camera and looking for like where it could be coming from, because she's not a candidate for surgery. So it doesn't completely surprise me that now that when we stop antibiotics, the infection has recurred again. Because we never ever were able to fix why she got the infection to begin with. Usually the bug that she grew is usually associated with a little hole in the gut, or sometimes a cancer in the gut that's just kind of eroded and caused the bacteria to go. So short of going in and fixing the hole, or going in and finding the cancer, the antibiotics for 2 weeks was just to band-aid, kill the infection short term, which doesn't surprise me. We stopped the antibiotics on Sunday. Monday, it was on imaging, it didn't show that it's recurred, and blood work was fine on Monday, but today the blood work is showing that the infection has probably recurred again. So I am going to start her back on antibiotics again. But it comes down to, short of fixing the underlying problem, we could,
just keep going.
Keep going, right? With so I'm going to give her the fluids. I'm going to, because now that we have the blood work, because your sister asked me, why can't we just blindly give her fluids? The problem with, we know her heart's not good. Fluids, when we give it, the heart has to pump the fluids I'm giving her. And if we just give fluids when she doesn't need it, like on Monday her kidney function was good, it would cause strain on the heart. But now...
Too much fluid.
Yeah, too much fluid, exactly. So now, though, with her blood work showing that she is dry, we'll give her the IV fluid, and I'll start her back on IV antibiotics. But, as I said, when do we stop? Because we can't get to the bottom of it. And stopping antibiotics on Sunday, and within 4 days,
it's back.
The white count shows that she's infected again. Of course, I'm going to measure her, get a urine sample again to see if it's in her urine, but it doesn't look like it, because we've been watching her urine on Monday again. There's no signs of infection there, too, so it's probably that. I also explained to your sister, too bad she didn't record me, the other, for the slow decline, I scanned her head today.
She explained it to me, but if you wouldn't mind explaining it again a bit.
She had a stroke. We know she had a stroke. On her January scan, like early January scan, it shows a fairly large territory, like it affects 2 lobes of the brain. When I scanned her again today, it's no new stroke, but the water or the swelling around the old stroke has increased. The problem is in the brain, everything's enclosed in the skull. So when you expand in your leg, there's room to expand, but in the brain, when there's swelling, sometimes a little bit of swelling can cause deterioration. That's what we also found. So until I got the blood work just now, we have that was also deteriorating, that's causing, because she started deteriorating since Friday already, before I even stopped the antibiotics, because the antibiotics were due to stop on Sunday. So that's why I told her, on the blood work earlier this week on Monday was pristine. And she was already like quite weak. We had that discussion. So I'm even hesitant to say if the infection is the cause of her decline over the last, week and a half, because it happened while she was on treatment. And
Yeah.
when her blood work was good on Monday, she was already declining. So is it what's going on in the brain that's causing the decline? Right now, of course, I'll give her fluids to fix her dryness, and the infection will
Antibiotic.
start her back on antibiotics, absolutely. But whether that's the cause of her slow decline over the last, week and a half, it might not be. We just might be treating everything as it's coming up, but it could be a slow decline of the swelling to the brain. Okay?
Okay.
Does that explain?
Yeah, you explained it great.
Yeah. So I'll start fluids again.
Yeah.
So she will start fluids. But again, how long do we keep fluids going for?
Yeah, we'll talk with that as a family. And
yeah. The minute we stopped antibiotics on Saturday, imagine if if she didn't decline, the only reason I kept her was because she's too weak for
go
Dad
home.
to handle.
Yeah,
She's too weak for Dad to go to and it's not like she was even weak on the weekend when I was talking to Dad already before antibiotics finished. So if it was an acute deterioration, she was well until Sunday, stopped antibiotics and we declined. That's one thing. But again, just stopping antibiotics and fluids for 3 days from Monday till now, she's declined. Are we confining her to IV fluids tied to the hospital? So that's why I also mentioned to your sister, if she doesn't eat, feeding tubes, I think that's not what she would want either.
No, we've talked about that. Yeah.
So that's something I'll start the antibiotics, I'll start the fluids, but
okay, and then we'll talk.
Yeah,
and
but
we'll
have that discussion moving forward. Within 3 days of stopping fluids, she is deteriorated so quickly. When is enough for her?
Yeah. Okay. Thank you very much.
You're welcome.
Thanks.
Okay, but I'll start that right away.
Thanks.